Next, we are going to have a recorded presentation, and that's from Dr. Olga Yakusheva. She couldn't be here in person, but she has an amazing message to share, so we're going to do a little swap of the audio in just a second, but let me just do an introduction for Dr. Yakusheva. Dr. Olga Yakusheva is an economist and international leading expert on the economic value of nursing to healthcare systems and payers. She is a professor of nursing and public health at the University of Michigan and an economics editor for the International Journal of Nursing Studies. Dr. Yakusheva's work has been published in top economics and medical journals, including Review of Economics and Statistics and JAMA. Her research team has led studies quantifying the value-added contributions of nurses to patient outcomes and to organizational financial outcomes to improve nurse staffing, reduce burnout, and promote the economic value of nurses. Dr. Yakusheva is the leading author of a 6-part series on the value of nursing practice, recently published in Nursing Outlook, and has written several recent articles on nursing reimbursement reform in Health Affairs and JAMA.
Hello, everyone. My name is Olga Yakusheva. I am a professor of nursing and public health at the University of Michigan. I'm an economist by training. It is my great pleasure to be able to send you a short video. I'm really sorry I couldn't be there in person. So let's begin. The title of my presentation today is The Lack of Incentive Alignment and Transparency. I'll start by reminding everybody about recent revelations of system staffing issues and dangerously poor quality of care at several large healthcare systems in the United States. This sparked an enormous amount of public outcry about hospitals putting profits over patients. However, much of the public discourse around these unethical behaviors misses an important nuance, namely that hospital staffing decisions are shaped by a complex system of economic and regulatory constraints that are created and overseen by governmental payment policies and largely replicated by private payers. Improving hospitals' behavior will require changing the policies that currently allow and even inadvertently incentivize hospitals to increase their operating margins through inadequate staffing. An abundance of data shows that healthcare organizations across the country are operating with too few nurses on staff. The average US hospital had a 15% nurse vacancy rate in 2023, more than double the pre-pandemic level. Although the numbers seem to be improving this year, nursing strikes are becoming a regular occurrence across the country, creating a loss of more than 230,000 healthcare workdays in 2023 alone. Nurses and other healthcare workers are openly voicing quality and safety concerns. Many have left their jobs since the start of the pandemic, and more expect to do so in the future. Yet, healthcare organizations have not prioritized investments in nursing quality. What hospitals must do to address the staffing problem is not a mystery or an unknown. According to the ANA survey of nurses, more than 2/3 list salary as the most important reason for accepting or leaving a job. This is followed by the work environment. Nurses stress the importance of adequate staffing, flexible schedules, and opportunities for professional growth and development. It is true that these requests are costly for the organizations, but it is also not the case that healthcare organizations do not have resources to adequately support nurses. When pressed, often by nurses' unions, hospitals have managed to address their staff's demands. In several recent strikes, hospitals were able to provide sizable raises, 20% and more, increase staffing, and reduce mandatory overtime. Given that hospitals can summon the resources to support nurses when necessary, why do they systematically deprioritize nurse staffing and work environments? The answer to this question requires a brief discussion of the economic realities faced by organizations in this value-based healthcare economy. The Patient Protection and Affordable Care Act of 2010 introduced the value-based payment model. The model links payment to patient outcomes and care costs. Poor outcomes and high costs lead to lower reimbursements and vice versa. Currently, 3 programs link organizational payments to the value of patient care. They are the value-based purchasing program, the facility acquired conditions reduction program, and the readmissions reduction program. Many organizations face penalties for underperformance, resulting in tangible financial consequences. Figure 1 shows the domains of the value-based purchasing program. Patient outcomes are divided into patient satisfaction, dark blue, clinical outcomes, orange, and safety outcomes in gray. Together, they comprise 3/4 of the current hospital performance score. Cost of care in yellow is the remaining 25% of the score. As you see, over time, the transition to value-based payments shifted the financial reward system from investments in the process of care in light blue to improving the outcomes and reducing the costs of care. And if it seems that healthcare organizations are putting profits over patients, there might be a fair amount of truth to this. In our market-based healthcare economy, organizations must be financially competitive to survive. Although an organization might truly care about their nurses and patients, their ability to do so is dependent on their bottom line. The key financial variable that determines long-term financial sustainability is the operating margin. The operating margin is the difference between earned operating revenue and operating costs. In value-based care, revenue is determined by the volume of patient encounters, plus or minus value-based penalties or rewards, also called pay-for-performance incentives. The revenue should be sufficient to cover all costs, including wages and non-labor expenses. A positive operating margin, when the earned revenue exceeds the costs, allows an organization to spend more on the nursing budget. A negative operating margin means that the earned revenue is not sufficient to cover the operating costs. When this happens, organizations must resort to budget cuts, leading to salary cuts, layoffs, and understaffing. Whether we're talking about nurse practitioners in an ambulatory practice setting or registered nurses in an acute or long-term care setting, nurses are all impacted by these economic realities. Nursing plays a dual role in supporting organizational revenue. First, nurses are the largest healthcare profession, and they provide the majority of hands-on patient care. Studies show that the quality of nursing care has direct implications for patient outcomes, including patient satisfaction, mortality, nosocomial infections, falls, readmissions, and others. Nurses are also not naive to cost effectiveness. They know when they see wasteful use of time or resources, low value care, or lack of fiscal responsibility. Yet, nurses themselves are costly to organizations. In many hospitals, for example, nursing salaries alone account for 30 to 50% of hospitals' operating expenses. In a value-based healthcare environment, the key question guiding resource allocation towards the nursing budget is whether it is expected to generate more revenue than it is expected to cost. Organizations will spend more on budget lines with a known positive balance of revenue over the cost, and less on those where the balance of revenue to cost is unaffordable or unknown. Unfortunately, nursing often falls in the latter category. This is due to a lack of transparency around the contribution of nurses to revenue and a lack of a tangible economic return to organizations from improving the quality of care. Fiscal transparency and a strong link between the quality of a product and its price are key factors that drive organizational decision-making across the economy. Consider a market for apples. There are consumers who want apples on the left-hand side, and there are apple growers, producers who grow apples. From the consumer perspective, an apple is worth buying if its benefit to the consumer is greater than the price. This includes the taste, the shape, the flavor, and its nutritious value. A consumer will pay more for a better product The higher the quality, the more a consumer is willing to pay. In fact, across the economy, from apples to cars to cell phones, about 70% of the price is the cost of quality. And this works because the price that the consumer pays is the revenue to the producer. A producer of higher quality product will have more revenue and will be more competitive compared to other apple growers. This will allow further investments in labor and non-labor inputs to improve the quality of the product, and the cycle continues. Now let's consider the healthcare market, including both the consumers, the direct beneficiaries of healthcare, and the organizations that deliver it. Immediately, you will notice a couple of key distinctions between the healthcare market and the apple market. First, unlike buying an apple, a healthcare consumer is largely unable to fully understand and evaluate the true quality of care. Patients do not want surgeries or shots. They do not enjoy them. They need to have them, even though they might be unpleasant. Second, unlike buying an apple, healthcare consumers do not directly pay organizations for the services they receive. Rather, by and large, they rely on insurance companies to monitor the quality of care and to reimburse healthcare organizations accordingly. However, as we discussed earlier, the current reimbursement model isn't sufficiently aligned with the quality of patient care. In fact, across all pay-for-performance models combined, an organization might see between 1 and 1.5% of its reimbursement payment linked to quality. This is compared to 70% in other markets. Simply stated, quality does not pay enough compared to the cost required to improve it. Additionally, because nursing is an invisible, non-transparent part of the bill, consumers have no idea what they're paying for, including nursing services. They might value nurses and truly trust them above all of the other healthcare professions, but they're unable to see how nurses' economic value aligns with the consumer value of nursing. A number of market-based solutions can be employed to improve the financial transparency of nursing and more strongly align payment with quality. These include expanding the focus and weight of nursing-sensitive quality indicators in the existing pay-for-performance metrics, creating and implementing new clinician workforce outcomes metrics, and aligning organizational reimbursement with the organizational investment in nursing. Throughout the day, you will hear my colleagues talk about ways to policy frame these ideas from different perspectives. I hope you stay for the next several presentations by John Walton, Rob Longyear, and Rachel Start to get a sense of a broad range of these ideas. Thank you so much for watching this video. If you have any follow-up questions or comments, please feel free to contact me. You can use the QR code on the screen to link to my profile in LinkedIn. Thank you.